Patients come in well equipped, much more equipped with knowledge and insights. Yeah, I mean, it might be wrong. They might be relying on Dr. Google, but for the most part, maybe they've been to tons of other specialists. Like my daughter my daughter and my wife and I have been to tons of specialists lately and gotten all kinds of contradicting information. But you've shown us the evidence, and the evidence is clear. And we're going to put links to Dr. Januzzi's slide deck, links to where you can go and get more information, where you can look at ordering these tests as well. But even if you're looking at geeking out and want to learn more, we'll put that information in the slides below. Our last and final question for Dr. Januzzi is, if you were to hang up your spurs today and say, you know what, I'm done, I've ran the race, I've finished it, and that last patient is why I did this. It's why I do this. Give us an example of where this really hit home for you recently.
I mean, gosh, as a cardiologist, there are a lot of really important examples of why we do what we do, right? And it ranges from the person who comes to the office worried about their risk, who unfortunately has that event that they were worried about. And then there is the patient that you take care of acutely ill and carry through their illness through a difficult hospitalization and send them home. And that day that you see them in the office and follow up, feeling well, looking great, those are all the things that for me matter so very much. I mean, I'm not in this space to be a researcher. I'm in this space to take care of patients, and it's nice that I can do both. And those experiences as a clinician are what make this job worthwhile. And it's hard to imagine hanging up my spurs, but someday it'll have to happen. And what I'll take away from my job, after the many years of working in the MGH Heart Center, is the combination of those personal experiences with patients that were so meaningful, together with the fact that I feel like maybe we may just have made a difference for them, with respect to the research that we've done.